Brain-eating amoeba disease, more formally known as primary amoebic meningoencephalitis, PAM, is a rare but almost always fatal infection of the central nervous system. It is caused by the microscopic amoeba Naegleria fowleri. The culprit, Naegleria fowleri, is a single-celled organism that lives in warm, freshwater environments, such as lakes, rivers, ponds, and hot springs. It thrives in sediments at the bottom of these water bodies. The entry point. The amoeba infects humans when contaminated water is forced up the nose. This can happen during activities like swimming, diving, water skiing, or even through nasal rinses using non-sterile water, such as with a neti pot. The path. Once inside the nose, the amoeba travels along the olfactory nerve to the brain. From there, it causes a severe and rapid infection, leading to the destruction of brain tissue and brain swelling. Important note: the infection cannot be contracted by drinking contaminated water. It also cannot be spread from person to person. Symptoms typically appear between 1 to 15 days after exposure and progress very quickly. Because the early signs mimic other brain infections, diagnosis is often delayed, which is a major factor in the disease's high fatality rate. Early symptoms: severe headache, fever, nausea, and vomiting, stiff neck. As the disease progresses, confusion, seizures, hallucinations, altered mental state. Coma death usually occurs within 3 to 7 days after the onset of symptoms. The survival rate for PAM is extremely low, with only a handful of survivors ever reported worldwide. Treatment: there is no single guaranteed cure. Treatment typically involves a combination of drugs, including the anti-parasitic medication and antifungal drugs. Intensive supportive care is also crucial to manage brain swelling. Prevention: since treatment is so difficult, prevention is the best defense. The Centers for Disease Control and Prevention (CDC) recommends taking the following precautions. Avoid warm fresh water. Stay out of warm, stagnant freshwater bodies, especially during the warmer months when water levels are low. Hold your nose. When swimming, diving, or jumping into warm freshwater, hold your nose shut or use nose clips to prevent water from entering. Keep your head up. In hot springs or other naturally hot water, try to keep your head above the water. Don't stir up sediment. Avoid digging in or stirring up the bottom sediment in shallow freshwater, as this is where the amoeba is more likely to be found. Use sterile water for nasal rinses. If you use a neti pot or other nasal rinsing device, use only sterile, distilled, or previously boiled and cooled water. Do not use unboiled tap water. While the disease is rare, the recent rise in reported cases in some parts of the world, like Kerala, India, has prompted public health warnings and increased efforts for awareness, surveillance, and early diagnosis.